Hey everyone, and welcome back to Feel for Free, and thank you for joining us today. Here we will be reaching out to different docs of chiropractic and giving them a situation that he sees to be that eventually stumble upon. We want to be able to give you an archived database of videos with different scenarios so that you need help articulating chiropractic in different ways so you'll be able to know how to approach it. To kick this off, we're so lucky to have an amazing doctor and professor of mine, Dr. Gina Edwards, who's practicing over in San Jose at Chiropractic for the Heart. How are you doing today?
Doing well, thank you, Hunter.
Perfect. So just to get it off started quick, my question to you is, how would you explain chiropractic to a 65-year-old man who has had bilateral knee surgery and is in constant pain? His chief complaint is in his low back, but the twist here is that he grew up in a time where chiropractors were looked down on. And the only reason he is visiting you is because you're his last resort. How would you approach this?
One, I would make sure that I had the utmost respect for this individual. If a patient comes to you and they verbalize that you are their last resort, it usually means that they're at a place of surrender. So just being humbled by the fact that someone is coming to ask you for help, but also be cognizant and mindful that a place of surrender for a patient is not always comfortable for them to be in. And so they've opened their heart up to be able to have that conversation with you. And it could be a very touchy subject, so tread lightly. So if he's had bilateral knee pain, I would just go through the whole head, body, where are you in time and space? I like to describe things on a more layman's terms. And so if he comes from a day and time period where he thought that chiropractors were quacks, so obviously I would stay away from that word. And I wouldn't invoke that kind of feeling, but I would invoke a feeling of, we know that one side of the brain runs the other side of the body on the most basic and limiting of explanations. If that's the gross motor, then the fine motor comes from the cerebellum. And just like his brain constantly looking for where is the little toe on the right side of the foot, or where's the inside of the ankle so that I don't hit the coffee table again as I round the corner to go to the kitchen. Just of those things that your brain is constantly looking for all your little bits and pieces to make sure that there is that mind-body connection, right? So it's not just a spiritual thing, but your brain physically looks for your body in time and space. So having bilateral surgeries on both knees, while that was helpful for whatever reason it was, because we have to honor that the patient knew what they were doing and for the best interest of them, given the information that they had, right? So we don't want to discount any other professionals or providers. We don't want to call them quacks and start, another process of going back and forth. You would say, look, your brain is looking for your knees, and there's been some pain. There may have been some degeneration. I would love to have any kind of films or prior history or even a full history on this fella. Your brain can't find them. And so now that you're coming in with this low back pain, you don't have your weight evenly distributed over the tops of the knees on those condyles. Does your brain know where your feet are? If there's been an interruption from your brain to your feet, then clearly your brain is looking for that neurologically. It's looking to see where all this information is so that it can send that message without interference. When we do cut on the body, I know I have been subject to multiple surgeries. It is an insult because it takes a while for the body to recover from that. Yes, it is good in some instances. I know having appendicitis and having it burst, it's great to get that out so that you don't go septic. But at the same time, it's an insult because it takes forever for the body to heal. Like it's the little fighter dudes of your immune system have to come into play. Your body has to do the leapfrog of tissues in order to close the wound. There's a lot of work that goes on there. So if they're continuing to have this low back pain, then clearly there's still this interruption. And do we want to continue down the track of insulting the body and asking it to work harder to get better? Or should we take a more conservative approach and say, okay, are the feet really hitting the ground the way that the body intended them to? Is the brain having to look for the feet? Does it feel taxing to go onto a walk? And then looking to see, yes, there may have been a surgery, but then looking to see, well, was the surgery a meniscus, or was it for a ligament tear, or was it for a total knee replacement? And addressing that at a higher level. Is the body having a hard time communicating back to the brain because the knees feel unstable because there's foreign equipment there. And then how do we make that connection with the patient of when they stand up, what's the first thing that they should think of? Feet. Why? Because that brings it to the frontal lobe. If we're bringing it to the frontal lobe and we're retraining the brain to go back and look for that little pinky toe on the right foot, then it creates that connection there. Having them do cross crawl exercises after a surgery helps solidify that connection of the brain going, oh, I know where the little toe is. I don't have to ask for it anymore. I know exactly where it is.
Just blew my mind. That was cool. Oh my God. I didn't even that. That's why I do this. This is awesome. Okay, that was so cool. I don't even know how to follow up with that. I just put so much different ideas in my head. Wow.
One, always make sure that you can explain it on the layman terms. If the fella is, you said he was 65,
Yeah.
that's the same age as roughly as my parents right now. My dad is about to be 75, so it's roughly about the same age. How do I explain it to him? He's had multiple surgeries. He too has had a knee surgery. He's had spinal fusion at some stage. And how do I explain to him how chiropractic is still prevalent in his life, regardless of whether or not he's had these surgeries? So when he was working out on his farm last week, he twisted his knee that he has had a surgery on previously because his body is looking for his foot. It's making sure that we stay bipedal, right? And he twisted on the very knee that he had surgery. Clearly there's a disconnect here. And he fell to the ground. And he said the first thing he thought of was immediately, oh, I don't know where my feet are. So I need to start looking for my feet, get back into practicing. Where are my feet? What's going on? How do I go from a sit to stand? Do I jump up out of my recliner and go off to do something? Or do I take a moment like most animals do as soon as they get up from a reclined position, they stretch. It allows their brain to go, where are all my appendages? Where am I doing prior to moving forward? So now he takes a stretch before he walks. Subsequently, since his fall, he actually called his chiropractor because he lives in a different state. And he said, and his wife was saying, oh, you need to call Gina, you need to call Gina, you need to figure out what's going on. He goes, forget it, I already know what I need to do. He goes, I'm not communicating in my body. I need to call my chiropractor.
That is so cool. That is so cool.
When
Wow.
you empower the patient with their own health and they become in tune with their own body, they become the better physician in aspects of themselves.
So it's basically like patient education to the point where they are so fine-tuned with their body that they understand exactly what they need.
Absolutely.
That is cool.
Absolutely.
Cool. Well, thank you so much for that. That truly blew my mind.
You're welcome.
That was awesome. So, for all those listening, that's all we have for today. Thank you for joining us on Feel for Free. We hope you enjoyed the new segment, How to Tuesdays. Remember, in the words of BJ Palmer, chiropractic is health insurance, a premium that's small and a dividend that's large. That's all we have for you today. So, thanks again for joining Feel for Free.
Thank you, Hunter.